Good morning. This is Dr. Rajesh Yadav. Today we will discuss topic endurance training. So what is the endurance training? Endurance training describes any type of athletic training that increases your body cardiovascular or muscular endurance. Endurance training is the act of exercise to increase endurance. Endurance training helps develop the body respiratory capability and muscular strength to sustain physical activity with lower injury risk for extended period. The term endurance training refers to training to the aerobic system as opposed to an aerobic system. Basically, when you engage in the physical activity, the stress will be increased if you are doing in single bout of exercise. But when you are repeating the exercise like 3 to 5 times a week or for several months, then it is called chronic adaptation. So endurance training is based on the overload principle. So what is the overload principle? If you are habitually overload a system, it will respond and adapt. Like stress increase response, that is acute, which occur by the single bout. But if you are repeating stress, then it convert into the adaptation. So there are four major factors or variables that affect the endurance training. First, frequency, second, intensity, third, duration, and fourth, mode. Now first we will discuss about the frequency, how the frequency will adopt endurance training. So the frequency of exercise session should be 3 to 5 days per week or intensity moderate to vigorous. If you are doing 3 days a week in compared to the 5 days, then you should do the vigorous exercise. But one thing you have to remember, you should not use the weekend variant, like if you are doing exercise like Friday, Saturday, Sunday. So instead of doing continuous 3-day exercise, we should use the exercise at the alternative days. So that will be more beneficial for the adaptation. Second factor is the intensity. Intensity training guidelines are typically based on percentage of one's maximum heart rate. So it is recommended the exercise intensity range should be 50 to 80% of your heart rate reserve. Now how can we find out the heart rate reserve? For example, if the maximum heart rate of an adult is 210 and resting heart rate or normal heart rate is 70. So heart rate reserve is equal to 210 minus 70 equal to 140 beats per minute. So in this way we can find out heart rate reserve. So the intensity for the adaptation or for the tolerance, it is 50 to 80% of the heart rate reserve. Now in this graph it is shown that if you are start exercise in beginning, so you should use the lower heart rate. So the graph is showing the training sensitive zone between 70 to 90% of the age predicted maximum heart rate highlighted. So this graph is showing that in the early age the heart rate is maximum, and as the age increases the heart rate is decreasing. So a minimum 20 minutes exercise is recommended daily if you want adaptation or endurance training. Next is a mode. So any activity using large muscles group that can maintain continuously, that is a mode. So mode is depend upon if you are doing the exercise, how we are doing the exercise, and how intensity and what are the time used for the exercise. So the exercise session should be started involve large group muscles that can be maintained continuously over the time. So the training intensity and duration can be progressively increased over the time. So that will be more beneficial for the endurance training. Now the term here is muscles plasticity. The term muscles plasticity refers to the capacity for the adaptive changes. It is characterized by the altered gene expression following a repeated stimulus such as occurs with the endurance training. In the endurance training, gene expression change, so protein will be changed and different protein will be formed. So for the protein, it involves muscles protein, structural protein, contractile protein or regulatory protein. So these muscles protein gene expression and its synthesis will be changed. The sample single bout of exercise activate number of primary signals. And if you are doing exercise over a week, then secondary signal will be activated and different changes occur, like mitochondrial protein synthesis will be increases, number of mitochondria will be increases, number of fiber will be increases, type of the fiber will increases, as increasing the large maximum oxygen output, stroke volume will be increases. Like this is the molecular mechanism of the endurance. In the graph it is showing that the primary signal are calcium. So like endurance training, primary signal calcium level will increase and AMP, ATP will be increased and free radical will be increased. Secondary signal calcineurin will be increased and calcium carbonate dependent protein kinase increase, as well as AMP activated protein kinase will increase, P38 and nuclear factor kappa B will increase. As a result, PGC1 alpha, that is peroxisome proliferated activated receptor gamma coactivator 1 alpha increase. That ultimately result fast to slow type of muscles, mitochondrial biogenesis and synthesis of antioxidant enzymes. In this way, the mitochondrial biogenesis will be occur and type of the fiber will be changed. So in the muscles flow, blood flow will be increased and Vmax oxygen will be increases. So this increase in mitochondrial oxidative capacity associated with the endurance training will result in greater ability to utilize fat or fuel, thereby sparing a carbohydrate store. Endurance training will also lead to an increase in maximum oxygen consumption. Both maximum cardiac output and maximum arteriovenous oxygen difference respond and adopt by a overload principle of the training stimulus. This is the figure that's showing here. A number of mitochondria increases, capillary density will be increases, free fatty acid enzymes, carnitine transferase enzyme increases, and here free fatty acid utilization will be increased and spare plasma glucose. This also shows how stroke volume increase and maximum cardiac output and ultimately Vmax increases. Here, arteriovenous oxygen difference increases, muscles blood flow, capillary, mitochondria will be increases. As a result, arteriovenous oxygen difference will be increased and ultimately V oxygen max increase. So if you are not doing continuous exercise, then another principle is a reversibility. That means whereas overloading will result in training adaptation, inactivity will result in the return to the baseline. In this graph, it is showing that if you are leaving the exercise, then it will downfall. That means muscle strength will be weak and Vmax oxygen will also decreases. So here it is shown the number of muscles fiber, mitochondrial content adaptation with the week of training or detraining. So that is detraining graph and that is training and it is retraining graph. So detraining timeline shows that decrease in the mitochondrial number and size will be increased, result in decrease in muscles oxygen capacity, result in decreased maximum arteriovenous oxygen difference, result in decrease in the Vmax. Decrease maximal stroke volume slower to develop. So that will be occur if we reverse the endurance training or we leave the endurance training. The summary. So what are the changes occur? What are the factors that influence the training, endurance training? We have discussed the muscles plasticity and altered gene expression during the endurance training. When the stimulus is removed, adaptation revert back to the baseline. These all we have discussed. Thank you.